Just one day after a Kenyan court found Health Minister Aden Duale in contempt of a controversial US-backed Ebola isolation facility, the minister made the rare decision to appear in court himself and apologize. But did he admit he had defied the court? Not exactly. Instead, Duale argued that neither he nor the health ministry had deliberately ignored the judge and insisted the dispute was based on a misunderstanding of what the court had suspended.
The Ministry of Health and the government of Kenya remain firmly committed to the constitutional principles of the rule of law, respect for court orders, and the independence of the judiciary. Immediately upon the conservatory orders, and in good faith compliance therewith, the government of Kenya and the United States of America suspended the proposed collaboration concerning the facility.
So why was the government pushing for the facility in the first place? The project sparked public outrage after reports emerged that Kenya could host a quarantine center linked to the Ebola outbreak in the Democratic Republic of Congo. Critics feared the country could become a destination for Ebola patients.
The fear that the Laikipia facility could serve as a vehicle for Ebola importation into surrounding community is scientifically unfounded.
The minister argued that Kenya needed a secure isolation center because of the movement of Kenyan soldiers serving in UN peacekeeping missions in Congo and the risk of Ebola crossing borders. But not everyone is convinced.
We will wish to remind the CS Health, Bwana Duale, that the Constitution is the grand norm and supreme law here in our country.
We will fight this government in the corridors of justice. We will also fight them in the streets of Nanyuki. To stand in solidarity with Nanyuki and say no Ebola quarantine facilities, not just in Nanyuki, but anywhere in Kenya.
It's a big exposure to our people. Well, we know even at the general hospital here, getting a painkiller is an issue. Like you have to go outside of the facility to go to the pharmacy so that you can acquire a painkiller.
The controversy has exposed a difficult question facing many African countries. How do you prepare for a deadly outbreak without triggering fear, mistrust, and political backlash?